Many people ask me a question, Doctor, we are suffering from piles. So, are we supposed to get cancer or malignancy in future? My answer is no. Piles cannot be converted into cancers. But if you have a rectal or anal cancer beforehand, before you have consulted, you have painless bleeding, you have some pain, some obstruction while passing stool, you feel a sense of heaviness, you are losing weight, you are losing your appetite. So the symptoms looks very similar to hemorrhoids, piles, but they are actually the symptoms of cancers. Many a times some quacks, some unqualified doctors may give the patient a sense of fear that if they don't get treated by themselves, these piles may turn into cancer. So this is just sort of a twisting technique to make a fearful patient for their treatment. So remember, piles do not convert into cancers, but cancers may have symptoms like piles. Another question which is asked is whether lack of personal hygiene can lead to piles or other anal diseases. Frankly speaking, it is not true. But if you already have these diseases, it's always vigilant, prudent to keep that area as clean as possible. As I said to my patient, that clean it as hygienic as you keep your face, because if you have masses of piles outside, if you have some wound over there, if there is some fissuring, the stool may get entangled there, which can lead to irritation, discharge, skin maceration. So it is always better that if you are suffering from any of the anal diseases, try to clean it as neatly, as precisely as possible to avoid secondary complications associated with unhygienic local conditions. Few people think that sitting on concrete or footpath can also lead to anal diseases, but again there are no scientific data or base to this presumption. Then few people might ask that can eating too much of spices or chilies can lead to piles? I would say to some extent yes, because all these substances produce an acid known as capsaicin, which produces irritation not only in your mouth but in your anal canal also, giving rise to sense of heat, pain, burning, itching, etc. And if you keep on eating these things, then certainly the disease may aggravate, may persist, giving rise to very classical anal disease. And obviously, if you have been suffering from any of the anorectal disorders, or if you have been operated upon, or if you are posted for any anorectal surgery, it is always better that you should completely stop eating chilies and spices, at least till your wound gets completely healed or your disease has been taken care of. People might get frustrated that once they develop piles, it cannot be cured, or you cannot have anything to prevent or to treat piles. But this is absolutely wrong. Piles at any stage of their severity, maybe early stage, maybe advanced stage, maybe very advanced stage with complications, can be completely managed, treated and cured with different approaches, which may consist of office treatment, medication, lifestyle changes, food habits, or eventually, if needed, some surgical maneuver. But never get lost, never get dejected that once you have developed piles, you are always have to live with it. It's absolutely not true to think about it. Also, people have a belief that if you don't get yourself constipated, or if you can avoid constipation, you will be avoiding your anorectal problems. In some sense it is true, because many of the diseases of the anal canal are directly related with your constipation. But for that matter, if you are constipated and you are trying different type of laxatives, stool softener, purgatives or other maneuver to treat your constipation in a hope that your anorectal diseases will also be vanishing after your constipation is over, is partly correct. But treatment of constipation itself cannot be a cure for your anorectal diseases. It has definitely a lion's share in your disease amelioration, but it is just a part. There are so many other things which are required to be managed. Then people also think that there is no medical treatment. Eventually, every patient who has been suffering from piles will have to undergo under the knife or to undergo a surgical procedure. But that is again not correct, because if treated in time, if diagnosed in time, proper instruction are followed, then almost 90% of piles, hemorrhoids can be treated without operation. But for that, one has to be very cautious, very particular, very religious, very sincere about getting it diagnosed, getting it treated with a proper follow-up, following doctor's instruction. So there is no reason that if you are doing all this, you will ever have to undergo any surgical procedure for your hemorrhoids.